how to train your brain to figure it out that what kind of leukemia is this? Is it ALL or AML or CLL or CML? Under 30 seconds on the peripheral blood smear on the questions which you have received, how to reach out to the accurate response. That's I'm going to teach you right now. The number one, you need to basically ask 3 questions in this process. And if you accurately answer these 3 questions, you get the accurate answer. And none of this is basically based on cramming or memorization of any fact. This is all based on validated, scientifically proven tools and concepts of the leukemias. If you apply them, it becomes very easy for you. Question number 1, if you see a peripheral blood smear and the options are ALL, AML, CLL, CML, the first question that you need to ask yourself that what I'm seeing on the peripheral blood smear, are they all mature looking cell or mature appearing cell, or I'm seeing immature cells also? If the answer is I am only seeing mature looking cell, I'm not seeing any bizarre looking large blastic cells, it would be most likely CLL, chronic lymphocytic leukemia. Plus in CLL, as you are all aware, you'll be seeing a lot of ruptured lymphocytes also on the peripheral blood smear. Those are called smudge cells or parachute cells or basket cells. Plus some other buzzwords would be for CLL that typically it would be seen in the adults, elderly population, 60 plus. Plus the tumor cells, the peripheral blood smear, they can show soccer ball-like chromatin pattern or cracked mud-like chromatin pattern. This is another buzzword for them. And definitely the diagnosis of CLL is done by doing flow cytometry, that these cells would be positive for CD5, CD23, CD200, all these characteristic markers. So this is now in this list of CLL, CML, ALL, AML. CLL is ruled out. Now I have 3 options: ALL, AML, and the CML. So next question, if while looking at the peripheral blood smear, you need to ask yourself that as I am seeing all this cell population, are all these cell population on the peripheral blood smear, on the peripheral blood of this patient, are there entirely immature blastic cell, bizarre looking large cell, or there is a kind of mixture of immature looking blastic cells and mature looking cell? You need to answer this question. And if you are getting on the peripheral blood smear that you are getting a mixture of immature looking cells, like you are getting a lot of myeloblast, promyelocyte, myelocyte, and also getting mature looking neutrophil, this is a characteristic feature of peripheral blood smear for CML, chronic myeloid leukemia. And chronic myeloid leukemia is also getting too many WBC, there will be very striking leukocytosis, very high WBC count. Now this is also not based on cramming actually, this is based on a simple principle that CML versus AML or acute leukemia, which I usually teach earlier also on the base concept of hypothesis of tale of 2 cities. The basic fundamental principle of CML versus acute leukemia, be it AML or ALL, is that in CML, there is a proliferation of myeloid cells are occurring in the bone marrow, precursor cells. But the myeloid precursor cells, like you know that they usually mature myeloid precursor cells in this stage. Myeloblast, promyelocyte, myelocyte, metamyelocyte, band from mature neutrophil. In CML, what is occurring that the myeloblasts are proliferating, but the myeloblasts are not trapped in that myeloblast stage. They are maturing down the line. They are becoming those myeloblasts. They are becoming promyelocyte, myelocyte, metamyelocyte band from mature neutrophil. But what is the difference? Fundamental difference with AML is that in AML, what is happening? The myeloblasts are proliferating, but they have lost the capacity of maturation or differentiation further down the line. The myeloblast cannot become myelocyte, metamyelocyte band from mature neutrophil. Like they cannot become mature neutrophil. Usually when I teach this, I usually tell it's a tale of 2 cities. You can think that this is a CTA and CTB. In CTA, what is happening that a lot of newborns are taking birth. In CTB, a lot of newborns are taking birth. In CTA, the newborns are basically trapped in that newborn stage. They cannot become the school-going kid, adolescent, mature adult. But in CTB, the newborns are taking birth, but the newborns can become mature adults. They can become school-going kid, mature adults. So 10 years down the line, what you'd be seeing the difference between 2 cities population, that in CTA and CTB, both the cases population is increased, but CTA is entirely filled with newborn babies, which is acute leukemia. And CTB, AML in that case, acute myeloid leukemia. And CML, what is happening, that the newborn babies, you are also getting newborn babies, you are also getting mature adults and all kind of population. And the whole population is increased with a mixture of population because there is no blockage of maturation or differentiation of the blast cells, myeloblast in the CML. So now I'm coming back to that question. If you see that on peripheral blood smear, that I am seeing mixture of immature cells. I am seeing some myeloblast, promyelocyte. I am also seeing mature looking neutrophil with a very high WBC count. This is a feature, typical peripheral blood smear picture of chronic myeloid leukemia. Chronic myeloid leukemia, when I teach, I usually tell them that they look like a family image, family reunion image. There is a baby there, there is a grandfather is also there, grandmother is also there, there is a newborn, the uncle is also there, the parents, father, mothers are also there. So I have myeloblast, I have mature looking neutrophil grandfather, I have the in process myeloblast, promyelocyte, all these cells are also there. That is the typical picture of the CML. Compared to an AML, you see entirely all the picture is made of newborn babies. So if you get that, the mixture population, mature and maturing cells, immature cells, this is a CML feature. Plus other buzzword would be CML, typically you would be seeing 50 plus around typical presentation, and the very characteristic feature they would be describing that massive splenomegaly, or they can say that there's a dragging sensation in the left side of the abdomen. This is due to increased splenic size enlargement. This would be the typical feature of this. Plus on peripheral blood smear and CML, you can also get eosinophil increased and basophils increased. These are the other features. So now in the list, CLL, CML, ALL, AML, CLL, CML has been crossed out. Now if I look at the ALL and AML are remaining. Now if I look at the peripheral blood smear, if I see that entirely the population is mostly is blastic population, immature looking, bizarre looking cells. This is, you have to think about acute leukemia, because acute leukemia's hallmark feature is blockage of differentiation of blastic cells. Blastic cells are multiplying, but blastic cells has lost the capacity of maturation. That is the hallmark feature of acute myeloid leukemia. Acute leukemia, by the way. If it is for myeloblastic, proliferation is occurring but myeloblast lost the capacity of differentiation, then it is AML. If it is lymphoblast are proliferating but they have lost the capacity of differentiation to mature lymphocyte, that is ALL. And that's why in WHO classification you see that they are characterized by more than 20% blast cells in the bone marrow or in the peripheral blood, because blast cells are replicating but they have lost the capacity of maturation and differentiation. So this is now so the third question that I'm going to ask you, that I see entirely on the peripheral blood smear a lot of blastic cells. Let's say in the question they mentioned that there is 37% blast are present, and the blast are showing presence of our rods. The blast are showing voluminous cytoplasm and lot of nucleoli. So basically they are talking about feature of myeloblast. So if you have more than or equal to 20% myeloblast on the peripheral blood smear, obviously it would become acute myeloid leukemia. That is the point you need to remember. So on peripheral blood smear, typically to make your life simple at the basic level, they give you our rods feature. If you see our rods on a blast, it is basically indicative of feature of myeloid lineage, myeloid blast. But in lymphoblast, this our rods would be absent. So the question number 3 that you need to ask you, that in both AML and ALL, I'm seeing a lot of newborn babies are there. But if they're on the forehead of newborn babies, there is our rod, there is a sticker there of our rod, that would be typically AML. But that sticker would be absent in the ALL. That is how you need to approach. This is the question number 3 that you need to ask to reach out that this is AML or ALL. So this is the way actually you need to think that how you should reach out that this is AML, CLL, AML, ALL. And obviously other features would be easy for you. Like if you look at age, that could be an added buzzword for you. In ALL, typically they're common in the first decade of life, 2 to 5 years. But in AML, acute myeloid leukemia, we see in mature adults typically. This is typical for that. T-cell ALL can also occur in the adolescents. But ALL is typically a disease of the pediatric population. This is the most common cancer in the children, ALL. So based on this principle, I think it becomes very easy for you. And obviously there will be markers. Markers I will discuss in a separate session. The markers would be helpful to differentiate between the ALL and AML. But this is on the basis of the peripheral blood smear. If you approach in this way, that are all cells looking mature, lymphocytes with some smudge cells, think about CLL. Are there is a mixture of mature and immature cell, maturing cell with lot of leukocytes, WBCs on peripheral blood smear, think about CML. If you are saying entirely immature population, think about acute leukemia. If they are showing our rods, it would be acute myeloid leukemia. If they are not showing our rods, it would be acute lymphoblastic leukemia. This is a simplified approach. Actually, how can you figure it out on that 30 seconds? I would continue with this in the further sessions also. Thank you so much.